I'm Tech Sergeant Watkins from the 6 LRS Vehicle Management Flight.
I'm Aaron Johnson from 6 LRS D Flight.
I'm Tech Sergeant Wilson from 6 LRS D Flight, and today we'll be demonstrating some SABC techniques.
My name is Master Sergeant Craig Wayman from the 6 LRS Fuels Management Flight. In this video, we'll be demonstrating some self-aid buddy care techniques. Under Airway Management, we'll talk about the ABCs, which stands for airway, breathing, and circulation. We'll demonstrate the head tilt, chin lift method, and we'll also demonstrate the jaw thrust method. We will also go over ways to treat life-threatening injuries and to stop and control the bleeding. Those steps will be shown sequentially. Each step should be done in the exact order shown on this video. You always want to start with the easiest way to stop the bleeding to the most severe, as the most severe will most likely lead to limb loss. We will begin with bandaging, then to direct pressure, then to elevation, then to pressure points, then to tourniquet, then to QuickClot. These bleeding control steps will be shown in this exact order.
Evaluating airway, we want to make sure we do three things. There's look, listen, feel. As we approach the down member, you want to place your head near their mouth and cheek. You want to look across the body. You'll be looking for the chest rising and falling for the lung compression. You'll be listening to their breathe, whether you hear a clear airway or something clogged or jammed in there. You'll also be feeling for the breath on your cheek that'll be coming out of their lungs and mouth. If the member is not bleeding, one of the first techniques you want to do if you do not suspect a head, neck, or spinal injury is the head tilt chin lift. What this will do is it'll open up the airway so that the flow of oxygen can go into the lungs. Taking your arm outside of the member's head, you place it on their forehead. Push down, rotating the head out, pulling the chin up. This time you want to take your other hand and open up the mouth using the jaw to allow the airflow to go through.
The next technique that we're going to be doing is the jaw thrust technique. One of the biggest things that you want to focus on is that we're not mobilizing the head. During this, we're suspecting a neck, spine, or head injury, so you do not want the head to move. One of the biggest mistakes that people make for this technique is they'll just grab the side of the head and then they'll open up the jaw. During situations like this, if you don't have your arms mounted, you increase the risk of moving their head around when using this technique. You want to make sure that you get down on the ground, you mount your elbows onto the ground, then you place the palms of your hands on the side of the head. You use your thumbs to open up the jaw. This allows you to open up the airway without moving the head. I'm going to be demonstrating how to use the emergency bandage on the upper part of the arm if there was a wound there. You want to make sure when you're first putting the bandage on that you leave it wrapped up and then you don't have it expanded all the way out. So first you apply where the dressing is, right on the wound. You'd go to the clamp, you'd put it inside, and then you want to put firm pressure on it, go in the opposite direction. When you're wrapping the bandage around, you want to make sure that you go over a bandage on either side, making sure that it's tight on there but not too tight where you're cutting off circulation to the arm. When you're going over each end just a little bit, that's preventing dirt and debris from getting into the bandage and making the wound infected. Once you get down to the end, you want to use these ends right here where it's barbed and put it onto the bandage and clip it in.
Today we'll be demonstrating the emergency bandage use on someone's head. If the member has an injury to their temple, we'll apply the dressing directly onto. As we begin to wrap, you want to keep tight, firm position as you wrap through, doing the best to ensure the wrapping is not in the member's eyes. As we come through, tighten into the clamp in reverse direction. This locks down and secures more pressure. As wrapping through, we will again pull the wrap slightly below and slightly above the dressing to keep out dirt to reduce any type of infection. As you proceed through, you'll have one wrap go underneath the chin. While doing so, you want to make sure it stays onto the chin bone and not the member's soft spot. That way they do not stop their breathing. This will ensure the bandage stays on tight without popping off. As you finish, you'll take the barbed end and wrap it back into the emergency bandage to secure in place. Other types of bleeding control that we can use is elevation procedure. Say the member has a slice on their upper arm, after applying direct pressure, would elevate the extremity above the heart. This would allow gravity to assist in slowing down the bleeding if it was to be too profuse. the member has a slice on their lower extremity, we need to elevate it 8 to 12 inches above the heart. For elevation procedures for a lower extremity, the member will be lying down. You grab their lower legs and you'll elevate them 8 to 12 inches, or if applicable, you can place them on your knees. This will allow gravity to slow down the bleeding while allowing the pressure to come back down to the heart. There are 3 main arteries we want to control for pressure points to help slow down bleeding. The first one will be in the wrist. It'll be the radial artery. It'll be right in the area right in here, and you can use a thumb, will be enough pressure, and just push in there, similar to a tourniquet, to slow down the bleeding. This will be for any injuries in the hand. Next artery will be up under the bicep. It'll be the brachial artery. It's located right between the bicep and the tricep muscle. For here, a thumb or about 2 knuckles should be enough pressure to press up in here to stop bleeding any from the upper arm to the lower arm. The third artery we want to look at is the femoral artery. It's located in the upper thigh. This will control all the bleeding that goes through the thigh down to the calf and to the foot. To stop this bleeding, you would have the member lay down and you would apply either a knee or the heel of your foot to press in and dig to locate and isolate that femoral artery to stop the bleeding. To better isolate the femoral artery, you use your knee and you place in, you kind of rotate your body weight and dig into the muscle to get your pressure down into the femoral artery.
The next bleeding control technique that we're going to use is the cat tourniquet. Now there's 2 different general types of rules that you would use using the cat tourniquet. It'd be care under fire and tactical field care. In the care under fire situation is when you're getting shot at. You're not going to want to spend a lot of time trying to figure out where to place this. So you're going to go up the highest part of the extremity that you're trying to use it. In this case, we're going to use the arm. So we're going to grab the tourniquet. We're going to go all the way to the top. We're going to first tighten the bandage like so, and we're going to Velcro it on. Then you're going to do 3 full turns and no more than that. Once the bleeding stops, you let the clamp go back in the opposite direction. You don't try to push it forward because then it can always bounce out. You'd also want to use this Velcro strap to go over, again preventing it from popping out and unwinding and allowing bleeding again. Apply the first tourniquet. If that doesn't stop the bleeding, your next step would be to grab an additional tourniquet and then putting it roughly around 2 inches below the first one that you applied. So again, you tighten it, then you'd grab your clamp, you'd rotate it no more than 3 times. Because I'm not trying to cut off the circulation right now, I'm not going to do more than 1 time. You let it go in the reverse direction so it doesn't pop out, and then you Velcro over that. The next way that you apply the bandage is under tactical field care. For this one, you'd put the bandage 2 to 4 inches above the wound. So we're going to generally say that the wound's right here on the elbow. We'd measure out 2 to 4 inches above that now, instead of going all the way up, and then we'd apply. You'd again do no more than 3 turns, Velcro over so it doesn't pop out, and that's the way that you do it if you're not getting shot at for tactical field care.
After fastening the combat application tourniquet, it is important to mark the patient's head with the letter T and the time at which the tourniquet was applied. Also, write the date, time, and location of the combat application tourniquet on the casualty card. If you are limited on resources and you do not have a writing utensil, blood can be used. The final step in controlling bleeding is the QuickClot Combat Gauze. This can be found in your IFAC kit. Again, this is the final and last resort step to control the bleeding. To better demonstrate the application of the QuickClot Combat Gauze, there will be a link popping up in the video now. It will direct you to a video showing you the application of the QuickClot Combat Gauze. Watch the video in its entirety to get the full understanding of how to apply the QuickClot Combat Gauze. That will be all for the video today. I'm Master Sergeant Craig Wayman from the 6 LRS Fuels Management Flight. Thank you for watching.